Hi and welcome to Lessons from the Grand Rounds. In today's episode of Journal Club, I'll be discussing a recently published landmark practice-changing trial in the field of hemato-oncology. So I'm talking about Endurance trial, which was published on 16th of July 2026 in the New England Journal of Medicine. So this phase 3 trial discusses the outcomes between continuous therapy, that is indefinite therapy, versus a fixed duration therapy of maintenance chemotherapy in patients with multiple myeloma. So why is this practice changing? So for example, if you have a case of multiple myeloma, which is standard risk, and you treat the patient on standard induction chemotherapy including VRD for 4 to 6 cycles, and now the patient is not fit or eligible for autologous stem cell transplant, which is the standard of care. The patient is put on a maintenance therapy, which usually includes IMID or lenalidomide, and we are not sure or clear about how much should be the duration of maintenance therapy, or should we give indefinite therapy, because most of these patients who are ineligible for transplant or heavily comorbid, have some of the organ failure which does not qualify them for autologous stem cell transplant, and continuing lenalidomide for a longer time not only give them adverse effects like cytopenias, recurrent infections, and sepsis. It also carries the risk of secondary malignancies. So this paper serves an insight on what are the pros and cons of either of the therapy. So this is a phase 3 trial which included standard risk myeloma patients who are ineligible for autologous stem cell transplant. So around 516 patients were enrolled over 6 years after the induction therapy, either by 4 cycles of KRD versus 6 cycles of VRD. So this step 2 was the maintenance phase. At that time, 516 patients were included in the maintenance therapy, and in 1:1 ratio, they were divided into either indefinite uh, maintenance therapy versus a fixed duration maintenance therapy, which was for 2 years. So both the group of patients received lenalidomide 10 mg once a day for the first 3 weeks, and a off of 1 week, which composed the 28-day cycle. So the primary endpoint of the trial was the overall survival, and the secondary endpoint of the trial was progression-free survival. So let's see the results after a median follow-up of 86 months. So the primary endpoint, which was the overall survival, was 68.6% in patients who had indefinite therapy versus 69% in the patients who have received fixed therapy, which is almost numerically same. And the secondary endpoint, which is the progression free survival, was around 36% in the indefinite therapy arm compared to 29.7% in the fixed duration arm. And the other thing is that the deaths were similar in both the arm, which was 80 each. And when we talk about the adverse effect, which include grade 3 or more adverse effects, the grade 3 or more adverse effects were seen in 62% of patients in indefinite group arm versus only 46% in the fixed duration arm. So the conclusion of the mm, trial was that there was no significant longer overall survival in patients with indefinite maintenance therapy as compared to a fixed duration therapy of 2 years. In fact, the indefinite therapy carried a lot of grade 3 side effects, significantly more grade 3 adverse effects in patients in the indefinite group, which is a very important outcome and a data to give us an insight about how much we should continue the maintenance therapy, especially in patients who are highly comorbid. Thank you.